How does a lymph node biopsy diagnose lymphoma? Imagine trying to solve a mystery inside the body. A lymph node biopsy is like collecting clues to figure out if lymphoma, a type of cancer in the lymphatic system, is present. When doctors suspect lymphoma, they need to look at the actual tissue from a lymph node. They do this by surgically removing part or all of the lymph node, which is a small, bean-shaped structure that filters lymph fluid and helps fight infections. This tissue is then examined under a microscope to see if there are abnormal or cancerous lymphocytes, which are the cells that can turn into lymphoma. The most common way to do this is called an excisional biopsy. It involves surgically removing the entire lymph node or a large part of it. This method gives the pathologist plenty of tissue to analyze, making it easier to identify lymphoma cells and determine their type. Sometimes, if the lymph node is hard to reach or large, doctors might do an incisional biopsy, where only a part of the node is taken. Less invasive options include core needle biopsies, where a hollow needle extracts a small cylinder of tissue, often guided by imaging. Fine needle aspiration uses an even thinner needle to collect cells, but it is less often used for lymphoma because it provides less tissue and detail. Once the tissue is collected, laboratory tests come into play. Pathologists look at the tissue under a microscope to spot abnormal lymphocytes. They use special stains called immunohistochemistry to detect specific proteins on the cells, helping to classify the lymphoma as B-cell or T-cell type. Molecular and genetic tests can identify specific mutations or gene rearrangements that confirm the diagnosis and give clues about prognosis. Flow cytometry is another technique that analyzes cell surface markers to distinguish lymphoma from other causes of swollen lymph nodes, like infections. This biopsy is not just about confirming lymphoma, it also helps determine the exact subtype and how aggressive it might be. Knowing the type and stage of lymphoma guides doctors in choosing the best treatment plan. After the biopsy confirms lymphoma, additional tests such as blood work, bone marrow biopsies, and imaging scans like CORT or PET are performed to see how far the disease has spread. In essence, a lymph node biopsy is a vital step in diagnosing lymphoma because it provides the tissue needed to identify cancer cells, classify the disease, and plan effective treatment. It remains the most reliable and standard procedure for diagnosing non-Hodgkin lymphoma and other lymphomas. If you or someone you know is undergoing this process, always consult healthcare professionals for personalized advice and care.